Good morning, students. This video is about the Pandora's box. What is a Pandora's box? We have read in our childhood about the Pandora's box. It had many things in the box and all. So Pandora's box is a fancy name for the abdomen. That means it contains a lot of things. And those lot of things are actually, these days you have so much deliveries from Amazon, from other food. So how they are wrapped? They are wrapped with clean films. They are packaged. Otherwise, they will just fall apart in the packaging box. So what is that? That is the peritoneum in the abdomen. So abdomen is a huge cavity, just like this room, just like a room. You have a lot of things in the room. And let's say in the room, you are trying to place certain balloons. You're trying to place one balloon here, you're trying to place one balloon here. Supposedly it's somebody's birthday. How do you place the balloons? There are two ways to place the balloons. Either there is a string with the balloon, either you put those balloons and tie them up with the ceiling or with the wall or wherever it's fixed, or else you can tie up the string of the balloon with a particular thing which is fixed to the wall or which is fixed to the ceiling. The same concept goes when we are talking of peritoneum, when we are talking of parametrium, when we are talking of pedicle. So basically there are two concepts you have to understand. Number one, in the abdomen there are lots of viscera. There is stomach, there is liver, duodenum, small intestine, jejunum, ileum, colon. All these things are there. In the pelvis, in such a small space, there is bladder, there is your ureter. In the abdomen, you have the uterus, you have the ovary and all this. So all these things cannot just lie like anything. They will go hayward. Whenever you are walking, your ovary is coming up in the pelvis and it's going into the abdomen. Does it happen? No, it doesn't happen. Why? Because they are well packaged. They are well packaged. The plastic bag in which they are put, it is known as the peritoneum. The plastic bag in which they are put, it is known as peritoneum. But there are some very decent and very quiet children. You have a class of children where some are very naughty and some are very quiet. So these organs which are inside that packet, that plastic packet, are the naughtier ones. The ones, they are quiet, they don't move really. They are plastered to the posterior abdominal wall. Those are the organs which are not within the peritoneal cavity or within that plastic packet. So the structures which are behind the plastic packet, we call it retroperitoneal. Retro meaning behind, peritoneum meaning peritoneum. So the packet contains certain visceras, so we call it intraperitoneal. Intraperitoneal. So if we compare the packet with peritoneum, in the packet, interior of the packet or into the packet, we call it intraperitoneal or simply peritoneal. The structures which are plastered to the posterior abdominal wall or which is attached to the posterior abdominal wall, they are not inside the packet, they are behind the packet. So this particular structures are known as retroperitoneal structures. These are known as retroperitoneal structures. Okay? Now, second thing is, if in the packet, first of all, in the packet you have got all the visceras, right? Now you put the packet inside the abdomen. You put the packet inside the box. The box is the abdomen. Now, if you want to hold the packet, if you want to hold the packet in a particular position, what you will do? You will put a sellotape from the packet to the box. So there are structures which will attach the peritoneum from the peritoneal surface to the anterior abdominal wall. To the anterior abdominal wall. Right? Next, in the packet, if you want those things which are in the packet to be in a particular position, you don't want them to roam around. You don't want them to float around. So what you will do? You will fix their position either to the wall or to a structure which is attached to the wall. So these are known as pedicles. These are known as folds, peritoneal folds or peritoneal pedicles. Now in totality, the entire peritoneal cavity in case of male is closed. It's a closed sac. But in case of female, the peritoneal cavity is not closed. The peritoneal cavity is open through the ostia of the fallopian tube. The ostia of the fallopian tube, it makes the peritoneal cavity of female open because it opens into the extraperitoneal space. It opens into the extra or the retroperitoneal space. Right? Okay. Next, we have to understand that, so this concept is, I guess, clear, that peritoneum is nothing but a packet. The organs inside the peritoneum are the organs, the things inside the packet. The organs inside the peritoneum is equivalent to the things inside a packet. Now, if you want to fix the things inside the packet, you have to fix it with the box in which the packet is fixed. That is, you have to keep it with the, you have to put sellotape on the box, right? You have to put sellotape on the box, one end at the box wall, another end at the peritoneal covered surface, the plastic covered surface of the thing. Similarly, when you want to fix the packet itself, you have to fix the packet with the anterior, with the walls of the box. The same thing occurs here. And how does it occur? We will be seeing shortly. So as I was saying that the male peritoneal cavity is closed and the female peritoneal cavity is open. And the entire peritoneal cavity can be divided into two big sacs. Two big sacs. A small sac which is known as the lesser sac, a big sac which is known as the greater sac. Now what is this lesser sac? The part of the peritoneal cavity which is posterior to the stomach is known as lesser sac. This lesser sac is present just behind the stomach and it communicates with the greater sac through the epiploic foramen. Through the epiploic foramen. So if we put our hand through the epiploic foramen, we will go into the lesser sac from the greater sac. Now what is the boundary of the epiploic foramen? So below we have the first part of the duodenum, above we have the caudate process of the liver, posteriorly we have the inferior vena cava, anteriorly we have the right free margin of the lesser omentum. Anteriorly we have right free margin of lesser omentum. I repeat, we can communicate from the greater sac to the lesser sac through the epiploic foramen. This you have to remember. Here is the stomach. So this hand is the stomach. So this stomach, behind the stomach there is the lesser sac. And now this lesser sac and entire thing is the greater sac. So this is the lesser sac, entire thing is the greater sac. So there is a communication in between. This foramen is known as epiploic foramen. This foramen is known as epiploic foramen. Epiploic foramen boundary is very, very important. Epiploic foramen comes as a short note. Epiploic foramen boundary anteriorly, obviously here what will be here is the stomach, then it comes as the duodenum. So first part of the duodenum comes below. Here is the liver. So under surface, inferior surface of the liver, posterior surface of the liver, we have the caudate lobe. Caudate lobe has a caudate process. So the upper boundary is by the caudate process of the liver. Posteriorly, in the posterior abdominal wall, two structures we have. We have the abdominal aorta on the left side, the IVC on the right side. So epiploic foramen is obviously more on the right side. So the posterior boundary is the IVC. Anteriorly, there will be the right free margin of the lesser omentum. Right free margin of the lesser omentum. This epiploic foramen through which we will have to insinuate our hand and we will go to the omental bursa. So we will go to the omental bursa or the lesser sac as we put our finger through the epiploic foramen. Epiploic foramen. Epiploic foramen corresponds to the porta hepatis. Epiploic foramen also corresponds to the porta hepatis. So we were talking about the greater sac and the lesser sac and they communicate through the epiploic foramen. Now what we have to understand is where is the greater sac? The greater sac is contributing to the entire peritoneal cavity except the part which is behind the stomach, which is the lesser sac. Now we come to the pedicles. We come to the pedicles or the folds, the pancreatic folds. Number one, we have got one term known as omentum. Omentum is the pancreatic fold which attaches to the stomach from anywhere. So it is hanging the stomach. There are two omentums, one is the lesser omentum, one is the greater omentum, right? Next, we have another thing which is known as mesentery. Mesentery is actually hanging a part of the small intestine from the posterior abdominal wall, or it is the attachment of this small intestine. It is the peritoneal fold that attaches the small intestine either to a retroperitoneal organ or to the abdominal wall. We have got another one known as pancreatic folds or peritoneal folds, like the gastropancreatic fold, the left gastropancreatic fold and all this. So these are the things which are actually connecting the different parts of the viscera with either the posterior abdominal wall or with the retroperitoneal organs, which are either way fixed. So this knowledge will be required to understand the peritoneum. What we have to understand is this peritoneal cavity is filled up with peritoneal fluid. Now the question is, we could have kept the visceras naked. We couldn't have really wrapped it up with the visceras. we couldn't have actually wrapped it up with the plastic named peritoneum. Why do we do that? We do that just to safeguard the viscera. The visceras are very delicate organs, so this peritoneal fluid acts as a shock absorber. So if there is a blunt trauma, do you really find the liver ruptures? No. In the films, you find so many fighting scenes and all. Do you find that, okay, fine, the normal scene, the liver ruptures, the spleen ruptures, or the intestine is ruptured? No, it doesn't. Why? Because of this shock absorbing capacity of the peritoneum. So in the next part of the video, we will go through some horizontal section and the vertical disposition of the greater sac and the lesser sac, just to understand that how it is present in the abdomen. For this purpose, we need to also mention that in the abdomen, there are some spaces also. The important spaces, what we have here are: number 1, paracolic gutter. Paracolic gutter. What is paracolic gutter? Now, colon is actually covered by peritoneum. Okay, the colon, the ascending colon, the descending colon, ascending colon is a retroperitoneal organ, and they are covered by peritoneum like this. So once they are covered by peritoneum, they are inside, they are behind peritoneum, so obviously they are retroperitoneal. So once they are covered by peritoneum, the peritoneum goes like this and comes back to the parietes. So the colons are present over here. So the peritoneum is going like this, it is going to the parietes and coming back like this. So this space which is beside the colon is known as paracolic gutter. It is known as paracolic gutter. This paracolic gutter you will come across a lot of times, because this is present in paracolic gutter, that is present in paracolic gutter. So for this reason you need to understand paracolic gutter. Another term you need to understand is the parametrium or parametrial tissue. In the pelvis you have many organs. They are there in the peritoneal, some are in the peritoneal sac, some are not covered. So the pelvic organ in the pelvis, they are placed, so the empty spaces in the pelvis, they are actually filled up with thermocols. What are these thermocols called? They are the parametric tissue. So this parametric tissue gets condensed at places to form ligaments. Okay. So the next part of the video, we will be explaining the vertical and the horizontal disposition of the peritoneum. So here we are going to study the peritoneum under two disposition. One is the vertical or sagittal disposition, and one is the horizontal disposition. Horizontal disposition will be at different levels, but the vertical disposition will be at the same level, the entire body. So now we are trying to draw the vertical disposition. For that we need to draw the parietes. So the parietes in front will start from symphysis pubis, and then we will draw the posterior one, which is the coccyx. So this is the coccyx. Now this is the anterior abdominal wall. So this is the anterior abdominal wall. As we all know that the anterior abdominal wall, this is the diaphragm and it is coming down as the posterior abdominal wall. So this is the entire parietes, and as I have already said that there will be some peritoneal folds which will be attached to the parietes, and the other layer of the peritoneum will be covering and will be reflected onto the parietes. So this is the anterior abdominal wall, and the other one was the posterior abdominal wall. Now we will see how the organs are disposed. This is the liver. The liver is the uppermost organ. After the liver, we are drawing the stomach. We are drawing the stomach. So this is the stomach. This is how the organs are disposed inside the body. This is the small gut. This is the transverse colon. This is the transverse colon. This posterior abdominal wall organ is the pancreas. This is the pancreas. Next we have the small gut. Next we have the sigmoid colon. So this is the small gut or the small intestine, and this is the sigmoid colon. Now we will try and see how is the peritoneum disposed. But we have to draw the pelvic organ. So this is a rectum. So this is the rectum and this is the urinary bladder. So we have already completed the disposition of the organs inside the peritoneum. So now we have seen that the peritoneum is coming and it is covering the surface of the liver. Then it is going to the inferior surface and coming on to the stomach. Then it is covering the anterior surface of the stomach. It is covering the anterior surface of the stomach and reflected as this is the first layer of the greater omentum. So this is the first layer of the greater omentum. And here we can see that the first layer of the greater omentum is coming and it is covering the transverse colon and going to the pancreas and then again going to the posterior abdominal wall. So this red one and the another one is the first layer of the greater omentum reflected as the fourth layer of the greater omentum. What happens to the second and the third? We will see it later. Now as we have seen that it is covering the anteroinferior surface of the pancreas after covering the surface of the transverse colon. So it is coming onto the posterior abdominal wall and is covering the entire small gut, forming the mesentery. So this is the red one is the mesentery for the small gut. Now the mesentery for the small gut, you can understand that it is from the posterior abdominal wall to the small gut and formed by the peritoneum of the greater sac. Right? It is formed by the peritoneum of the greater sac. Now again, this is the sigmoid colon. So this mesentery, which is the sigmoid mesocolon, is also formed by the peritoneum of the greater sac. Now the next, it will come in front of the rectum and it will get reflected from the superior surface of the bladder and it will go and cover the anterior abdominal wall inner aspect and will end over there. So this cavity which is formed is the cavity known as the greater sac. It is known as the greater sac. Now we will see that how is the lesser sac formed or what is the peritoneum of the lesser sac. Now this will come from the liver. It will cover the undersurface of the liver and one part of the superior surface. It will also cover the posterior surface of the stomach. It will cover the posterior surface of the stomach and will ultimately come to the second layer of greater omentum, and as we can see, the second layer of greater omentum is reflected as the third layer of greater omentum. So it is reflected as the third layer of greater omentum and it is going to cover the transverse colon and this is the transverse mesocolon. So transverse mesocolon is attached to the anterior border of the pancreas where the peritoneum of the lesser sac is covering the anterosuperior surface and the peritoneum of the greater sac is covering the anteroinferior surface. So this blue line bounded area is the lesser sac and the red color which is being done is the greater sac. So you can see how the greater sac is being colored and you can see this very nicely that the greater sac is almost, the peritoneum of the greater sac is almost covering all the visceras. It is covering all the visceras, and the mesentery and the sigmoid mesocolon, these are all derivatives of the peritoneum of the greater sac. Only the transverse mesocolon, the greater omentum, here in the greater omentum you can see first layer the peritoneum of the greater sac, and it is being reflected as the fourth layer, which is the peritoneum of the greater sac again. The peritoneum of the lesser sac will be the blue layer, which is the second layer, which is reflected as the third layer of the greater omentum. So this blue colored part is the lesser sac. This blue colored part is the lesser sac, and this lesser sac is otherwise known as omental bursa. This lesser sac is otherwise known as omental bursa. So the omental bursa is the largest peritoneal recess that is going from the greater sac behind the stomach. It is called lesser sac or omental bursa. And if we see here, after the coloring is complete, we will see that the epiploic foramen is placed where the greater sac communicates with the lesser sac. The greater sac communicates with the lesser sac at the epiploic foramen. This is the epiploic foramen where the greater sac is communicating with the lesser sac. So this is the vertical or sagittal disposition of the peritoneum, and this particular diagram is very important for you to understand the disposition of the greater sac and the lesser sac. This is the horizontal disposition of the peritoneum below the level of transverse colon. So we see this, we again draw the parietes, and this is the parietes where we have to place the anterior wall and the posterior wall. In the posterior wall we will be first placing the abdominal aorta. This is the abdominal aorta, which are fixed structures on the posterior abdominal wall. So this is abdominal aorta. The next one is the inferior vena cava. These are the two structures which are fixed to the posterior abdominal wall. Next, this is the posterior abdominal wall, and in front it is the anterior abdominal wall. Here we get, on the left side we get the descending colon, on the right side we get the ascending colon. So these are also retroperitoneal structures, that is structures behind the peritoneum. Structures behind the peritoneum. Here we get the small gut, and now we will see how the peritoneum is getting reflected. In this diagram we will see what is known as the paracolic gutter, and mesentery is formed by what. So these are the median umbilical ligament, medial umbilical folds and lateral umbilical folds, and this is the greater omentum. This is the greater omentum. So now we will see how the peritoneum is reflecting. So these are the medial umbilical fossa, medial umbilical fossa and lateral umbilical fossa. So lateral umbilical fold, this is the medial umbilical fold, and this is the median umbilical fold. Now the greater omentum will be coming, it will be covering the descending colon, and then it will be covering the, so it is, as you can see, the mesentery is formed by the greater omentum. So actually it is not covering the descending colon. So you have seen that the mesentery is actually the derivative of the greater omentum, and you can see the paracolic gutter. The paracolic gutter is made by the greater omentum by the sides of the two retroperitoneal organs, that is the descending colon and the ascending colon. So we have done the sagittal disposition or the vertical disposition, and now we are doing the horizontal disposition at the level of the epiploic foramen. Now at the level of epiploic foramen, meaning the level at which the lesser sac is communicating with the greater sac. Now obviously this is the parietes, where first we will see the liver. So this is the liver. Next we will place the stomach. This is the stomach. Next we will place the spleen. Now this is the spleen. So here we will try to put IVC at the posterior abdominal wall, and this is the abdominal aorta. And by the sides there will be the kidney, which are retroperitoneal organs. Now we will see how the greater sac is coming. So this is the peritoneum of the greater sac. It is covering the entire liver, and then it is coming reflected on the parietes. It is coming to the posterior abdominal wall. These are the posterior abdominal wall organs, retroperitoneal. As you can see, it is covering the stomach, and as it is covering the stomach, it is hanging as a pedicle. This pedicle is known as lesser omentum. This pedicle is known as lesser omentum, which is actually from the stomach to the liver. It is from the stomach to the liver, and it is covering the other part of the stomach also, and again it is covering the spleen and then getting reflected back onto the parietes and will be completing the greater sac. Now here we see that the greater sac is completing itself, and you can see that we have drawn 3 dots. That is the right free margin of the lesser omentum, which contains the hepatic artery, portal vein and the bile duct. So the one which is hanging the liver from the parietes is the falciform ligament. Then we have got this pedicle which is joining the stomach with the spleen. It is known as gastrosplenic ligament. The one which is in between the spleen and the kidney is the linorenal ligament. And this is the lesser omentum, and the one which contains the pedicles is the right free margin. And here we can see that the epiploic foramen boundary. The epiploic foramen boundary will be posteriorly by the IVC, above by the caudate lobe of the liver, in front by the right free margin of the lesser omentum, and below by the first part of the duodenum. So this is the horizontal disposition of the peritoneum at the epiploic foramen, where we can see that the lesser sac is communicating with the greater sac. So this video will tell about the horizontal disposition of the peritoneum above the level of epiploic foramen. So here the epiploic foramen is not present, that is the lesser sac is not communicating with the greater sac. The last video we have seen it is communicating with the lesser sac, the greater sac and the lesser sac. So this is the parietes where we have to put this is the liver with fissure for ligamentum venosum, this is the groove for IVC, and this is the liver. Then we place the stomach over here, and then we have to similarly place the spleen. Here there will be only aorta, and the IVC will be in the groove for IVC. The IVC will be in the groove for IVC. Now here we have to understand, we will see the tracing of the greater omentum and the lesser omentum, that how it is going to get disposed. So as the retroperitoneal organ, we have the kidney on the left side, but the right sided kidney is obviously lower down, so we just can see the right suprarenal gland, and we can see the IVC in the groove for IVC. Now we will see how the peritoneum is coming. It is the peritoneum of the greater sac which is coming as falciform ligament, and it is covering the liver, and it is going into the fissure for ligamentum venosum, getting reflected, covering the stomach, then coming to the spleen, covering the entire spleen. So it is going to get reflected in the parietes to the falciform ligament again. Here the other side, it is again going to get reflected to the parietes. So here we see this is the greater sac which is covering. Now we have to see the lesser sac. The peritoneum of the lesser sac is going to be reflected from the ligamentum venosum, fissure for ligamentum venosum, covering the posterior surface of the stomach. So this purple lined area is the lesser sac, and as we can see that lesser sac is just separating the stomach from its stomach bed. Now if you can see the stomach bed, the posterior surface of the stomach which is related to the lesser sac, beyond the lesser sac there is abdominal aorta, beyond the lesser sac there is kidney, beyond the lesser sac there is right suprarenal gland. So these are all the structures that come in relation to the stomach's posterior surface in the stomach bed. So here the lesser sac is closed, it is above the level of the epiploic foramen, and hence this lesser sac does not communicate with the greater sac. Here the lesser sac does not communicate with the greater sac. So now we are going to talk about the horizontal disposition of the peritoneum between the epiploic foramen and the root of the transverse mesocolon. So the first one was at the epiploic foramen, the second one was just above the epiploic foramen where the lesser sac was closed. Here it is just below the epiploic foramen, between the epiploic foramen and the root of the transverse mesocolon. Now this is the parietes again, and as the parietes we just place the liver, we again place the stomach, and we place the spleen. Why it is? These are the three organs which are of immense importance, and these actually are the pivotal role player in the disposition of the peritoneum. So we are keeping this. So here between the epiploic foramen and root of the transverse mesocolon we have the portal vein. So the splenic vein draining into the portal vein, we have to show it here. This is the portal vein and this is the splenic vein. Apart from that, the next one we should continue over here. So here we place the pancreas. So pancreas is a retroperitoneal organ. So obviously the pancreas is placed retroperitoneally, and here we have the transverse colon. Here we have the transverse colon. Next we have the kidney on two sides, and as usual we will be having the aorta and the IVC. Now we will start the disposition. So from the falciform ligament again, the entire liver is ensheathed and it is just coming. The entire liver is ensheathed, it is just coming, since it is directly coming to the stomach, and you see it is going reflected to the skin, reflected back to the parietes, and it will close the greater sac. So we see that the transverse colon, the kidney, they are not covered by the greater sac peritoneum. And also we can see one surface of the pancreas is covered with the lesser sac, and in between the transverse colon and the lesser sac we will be finding the gastroduodenal artery. So this is the disposition of the peritoneum at the level below epiploic foramen, in between epiploic foramen and root of transverse mesocolon. So this is the lesser sac. So you can see that how lesser sac is coming.